Good morning, everyone. This is State Assemblymember Carlos Villapudua. I want to welcome everyone and thank you for joining us today for this conversation on COVID vaccine and heart health. I'm excited to be joined today with Dr. Machadi, a well-renowned cardiologist based out of our district in Stockton. Dr. Machadi has an abundance of experience with patients' care and sports cardiology. He currently serves as the team cardiologist for the Sacramento Republic professional soccer team and also works with the cardiac consultant for the University of the Pacific Athletics. Dr. Machadi, thank you so much for joining. How are you doing first? Let's break the ice here and just have a general conversation before we dive in. So how are you doing, sir? And thank you for joining us today.
Thank you so much for that kind introduction. I'm doing quite well, and thank you once again. It's great that we can help the community through this program that you have put forth, Assemblymember Villapudua, and we are very proud of you to be part of this community and helping the community.
Thank you. So I just want to thank you again for taking the time out of your busy day, your schedule to join us today. I know that this is a very important discussion, in not just the state of California, but I look at my district, and I hear all some of the issues and problems that, one has, right? And I sometimes just look at and hear like just friends and family, younger folks that are having these issues more and more. You hear it more and more. You hear it within family, right? And I just wanted to just thank you because this subject is very important, dear, to all of us. We all know somebody. We all have experience. We're related, or we know a friend, and it's. We kind of sometimes put it behind us or don't want to think about it. But I think that this is something that has to be part of the forefront of folks to really get more of a handle of this issue. And, I'm Hispanic, right? And I hear this more and more, even in my community, right? I mean, so as much as we try to, practice, eat better, work out. I mean, it just sometimes it seems like we have to figure out how can we message this even stronger. And today I am very thankful for you to join us, because this is how we want to start in our district is to message this. It's not about politics for me. It's about trying to keep our community healthier. So again, I want to thank you, and I know that you have some good presentation that you want to give us. So I'll let you dive in with that now.
Wonderful. So as you mentioned, on top of what I do outside of my practice, I'm also a vaccination center. I'm a small solo practice office here. I have an office here in Stockton and Lodi. And we were able to have vaccination from the offset. And we've been able to administer almost 1,000 vaccines through my practice. And as you know, in this community, 40% of my patient population are Hispanics. And probably about 10-15% are African Americans. And then we have wide variety of different kinds of backgrounds, including Asians and so forth. So truly, patients trust their physicians and their pastors. So we had to lead by example and be one of the first ones to get the vaccination, and then prove to everyone that it is safe. And we send out an email to all my patients, and we've been having quite busy clinic helping and vaccinating and administrating vaccination to our community. So I do have a lot of experience with these vaccines. I do have a short presentation, and then there are already some questions that has been sent to me that we can address, and we can go from there. So at any time during my presentation, if there are any questions, please don't hesitate to ask me.
Perfect.
So let's start. I'm gonna share the screen here, go to my presentation, and then play it somewhere here. There we go. Play it button. If I can get somehow move this. There you go. So vaccine and heart health. These are some background about me. So first and foremost, we need to know people that are more vulnerable for once they have COVID-19 and the infection, that they'll probably most likely end up getting hospitalized or possibly even possibly die from this disease. As you mentioned, as I remember, Villapudua, you know a lot of friends and family that have already contracted this and possibly even have passed away. As you know, Hispanics especially, a significant number of them have one of the highest mortality because of this. And it is extremely important first to educate, like we are doing right now, regarding this disease process, and then how we can prevent it, and of course, how we, through vaccination, we can finally see the light at the end of the tunnel and move back to normal life. So, as you mentioned, many Hispanics and also minorities in this area are not well educated regarding diet and exercise, and they tend to eat everything. They tend to not exercise as much. Um, and so therefore they end up having diabetes, high risk for hypertension and obesity, and coronary artery disease. If you have one of these disease processes, and then your chances of getting hospitalized and possibly even dying is much higher. So it is extremely important to understand and I have a very simple uh, advice for people. You don't have to go to South Beach diet, and so many other diets are out there, but the most important thing to remember is that eat a lot of fruits and vegetables, nuts, fish, and cut down on fried food, dairy products, a lot of fat content in it, sweets as much as possible, carbohydrates as much as possible. Cut down on these, and a lot of fruits, vegetables, nuts, and vegetables, and exercise. Easy, simple. Of course, red meat over and over again. Studies have shown uh, people that eat or meat eaters end up having much less lifespan than people that do not eat frequently. So cut down on red meat as much as possible also. So if you cut down on your risk factors, then there's much less chance that you will have these disease process, and you have much less chance of dying from any disease process, not only COVID-19. Hopefully this will be a wake-up call for everyone. So I mentioned the prevention, I mentioned diet. Exercise is extremely important. More and more we are learning about the benefits of exercise. It's a magic pill that all you have to do is 30 minutes. That's all we ask. 30 minutes, 5 days a week of moderate exercise, which is about between 3 to 6 miles per hour. That's about it. And you can reduce the risk of stroke and heart attack up to 50%, especially for those who have a sedentary lifestyle. So exercise is extremely important. In fact, I just finished my second book on exercise health, and should be out in print in about 8 weeks or so. So then weight loss, as we mentioned, it's simple. And lastly, to fight off this disease and we can go back to our normal life, is vaccination. So we'll talk about vaccination. A lot of there are a lot of denials out there, as you know. It's not really a disease. Look at the mortality. A lot of people are dying compared to everything else, and so forth and so on. But as a cardiologist and a sport cardiologist, we know that when there was a study that came out last year, the JAMA study, Journal of American Medical Association, that looked at 19 asymptomatic, meaning they had absolutely no symptoms, and the EKG was even normal. and the ultrasound of the heart was normal. But when they did troponin, which is an enzyme released by damaged heart muscle, and cardiac MRI, they know that they can see that there's still inflammation in these cells. And these inflammation that occurs within the heart cells can lead to arrhythmias, chest pain, short of breath, even cause weakening of the heart muscle. So this is mainly the main reason that I probably have evaluated not only professional athletes, but also college athletes and even non-athletes that come through my office that had minor symptoms or asymptomatic with COVID, but about close to 80% of them, as we know, probably have some kind of inflammation, which can lead to issues. So we initially recommended that they should stay off athletic activity for about 3 weeks. Then we said 2 weeks. Now between 10 days to 2 weeks, if their EKG is normal, echo is normal, even if they have these inflammations, then they possibly can go back to exercise without having any secondary issues. So it's a really weird disease. We're still trying to learn more and more about it. We really do understand. We know that high risk people have higher chance of mortality, and then we hear quite very healthy athletes and so forth end up getting it and becoming very sick and possibly even dying. So
you mentioned something, doctor. Sorry not to interrupt you, but I hear a lot of folks that will say, they had a stroke, right, or then they have a stent, and then they see their doctor and they're following everything they're supposed to be doing. Their EKG is well, their blood pressure is somewhat good. So they feel like, okay, I can start over again. I can start eating normal. It's like their life has started over again. Like it went from, back to normal. And I'm not an expert, but sometimes I always tell people, no, you have to, it's not like you're starting new again, and I think that message out there probably, I don't know if it comes from not knowing, or I don't think it comes from a doctor, because I don't see a doctor telling that, hey, you can start eating whatever you want to eat again. I mean, is that somewhat true that, if their EKG levels are good, their blood pressure is low, that they can start back eating whatever they need before, or should they start still keeping to their diet?
Right. So very good question. So I always say that the best intervention is prevention. Okay. So if you didn't want to be in the path of getting stents or getting bypass surgery and having heart health disease, then you have to start early on. Diet and exercise, do all the right things all the time so that you don't end up having a disease process within your arteries and your heart. Once you have it, and once we put a stent there, then it's basically you always have the disease. It's basically putting a bandage over the problem. You're not cured. People think they're 100% cured and they can do whatever they want. This is not true. It's more of a systemic process. It's a systemic inflammatory process secondary to lack of exercise and bad diet, stress, diabetes, high blood pressure, family history. These are all factors that can lead to having this process of inflammation, and of course, age and being male, inflammation, and then blockages and so forth. So to answer your question, absolutely. Not only you have to eat properly and watch your diet from then on top of that, you have to comply with the medication. And the medications are extremely important, especially cholesterol medications. It's a combination of things. The whole lifestyle change has to happen. And truly, I have seen patients that follow this precisely, and then they have much less issues of coming back and getting more stents or needing a bypass in the future. So it is extremely important to stick with when we see patients and I treat patients, okay, it's a two-way channel. I do my part, you do your part. Together, then we can help you live long and do well. So so that's a very good question, and we can talk about that even more later.
Yep.
So back to the signs of possible heart issues. So how do you know if you have COVID-19 and you're still having heart issues? Some of the warning signs are dizziness, chest pains, short of breath, swelling of the legs, you're feeling palpitation in your heart, or when you lie flat, you start getting shortness of breath. So these are all signs that something is wrong with your heart muscle and the cells. They're inflamed and it's causing issue, and they're giving you warning that okay, you should lay off activity and immediately go see your physician where you can be helped further. Okay, so know these symptoms. It's extremely important that if you continue to have these symptoms, sometimes people just quarantine and they think after 2 weeks they're fine and can go back to whatever they want. But if you have any of these symptoms, that means uh, you're not getting better and you're probably getting worse, and you should uh, go see a physician immediately or go to the emergency room. We're trying to keep people away from emergency as much as possible, but um, go to your primary physician's office and so forth first. But if you're quite sick, emergency room is a place to go. They've done quite well, especially in this county, in isolating different COVID sections, and transmission through emergency room is quite low anyways at this time. That brings another point. We have seen, as you know, I'm a past president of cardiology for the California chapter for American College of Cardiology, and we, through board of governors, we have a lot of communication with the other states and other governors and so forth, and we have seen a significant rise in heart attacks during this time because people delay, and deaths because people delay going to the emergency room because being afraid that they can contract COVID-19 through the emergency room. So if you're having significant chest pain, you should call 911 and be the risk is much higher for you dying than contracting COVID-19 at the emergency room. So I had to put that out there.
Good.
Don't be afraid of going there. We can save lives. We can open up the artery as soon as possible to lower the chance of mortality in these people. So, any questions, or you want me to continue?
No, continue, doctor.
Okay. So, a little background about vaccines. So, we have 3 that have been approved through FDA. One has a pause, and pretty sure within days the pause is going to be lifted. But as you know, the Pfizer was the first one that came out, then Moderna, then J&J. So Pfizer, initially it was difficult to get to everyone because it has to be stored at the super cold temperatures. But now they have found a way that you can even have it in the freezer for 2 weeks and you can still use it. It doesn't have to be in sub-zero temperatures. So as you know, there are 2 shots. 3 weeks apart. Everyone over age of 16, now that in California it's opened up, is eligible to get this. Moderna is the one that I've used a lot in my office because of storage. So also 2 shots, 4 weeks apart, age over 18. Those 2 are novel vaccines where the technology uses messenger RNA, where it basically it sends a message to our own cells to make the spike proteins, which tricks the body thinking it's the COVID virus, but it's not. And the body makes the vaccine. I'm sorry, the body makes the antibodies, which are ready and prone to fight off any actual virus if we are exposed. Moderna is the same way. It works the same way. And these are, as you know, after 2 shots, after the second week, you're up to 95% protected. Not 100%, but 95%. But studies coming out of Israel, since they're one of the first ones and one of the first countries that have had almost 70% of their population inoculated, and they have noted that almost 100% reduction in mortality for people that have these two vaccines. Um, so very safe, very effective. There's shouldn't be any hesitancy in people taking that. Next one that was just recently approved was J&J or Johnson & Johnson, mainly because it's a one-shot and done business.
Yeah.
Simple. It's a DNA type of technology rather than messenger RNA. So they send the DNA into the cells through this driver called adenovirus, and it goes into your body and it makes the same spike protein like the other ones. As you know, every medication that you take, every medication that you take over the counter or even prescription, there will always be side effects. We always weigh the risk and benefits of anything like that. So Johnson & Johnson, extremely rare, as you know. They've noted that 6 out of 7 million people that were inoculated and women age of 18 to 48 develop this vague clotting disorder. And it's not just having blood clots in your back of your knee when you're traveling a lot or
Yeah.
using birth control. It's different. They see it in the brain in a vague area in the cerebral veins rather than in the arteries. So it's a different type where your platelets, which is a component within your blood that helps your blood to be sticky, that also goes down. So it's a thrombotic purpura, we call it, because TTP or ITP, this is what it's called. It's like an autoimmune process. But as you know, and as you see, only 6 out of 7 million, I don't know, even go 0.00001% or something, that may have this issue. So FDA is now proving it again, most likely stating that it's a rare occurrence. That's what people at least know about it. How do you know if you have it? It usually happens 5 to 6 days to 13 days after you get the vaccine. What are some of the symptoms that you may feel? You may get swelling in your legs, you may get chest pains, or you may get shortness of breath more than usual. These may suggest you may have a clot, and you should probably have a blood test. But as once again, weighing the risk and benefits of getting COVID versus getting vaccines and not only helping yourself, your family, your community, and nationally, internationally. We all have to work together to fight off this pandemic and back to normal.
Yeah, I'm glad you brought that up because that's actually one of the questions of the J&J, right? I mean, especially in Stockton, it was here. And I guess the question would be like the safety component, right? The safety of the vaccine with folks who recently received it. What can you say to folks that might be worried, or in when its resumes again, right? I mean, once it's back, I mean, what can we say to them for that they have a little bit more confidence in this?
Right. So once again, extremely good question, because now people are worried, oh, why was there a pause? Because these are novel vaccines for this novel virus, and the release of them has been expedited. Whenever they see any issues, such as even 6 out of 7 million, for the safety reasons, they pause it to kind of investigate further to know, is it a serious issue? Is it widespread issue? Or is it just a extremely rare occurrence that possibly can be there and it's not really deadly? So to answer your question, it's probably going to come out with FDA stating that there is a rare possibility of a clotting disorder with this vaccination. So we inform our patient population. We have Pfizer, we have Moderna, these are the benefits of this one, these are the risks of this one, and so forth. I mean, when Pfizer came out, when I was one of the first ones to get it as a physician, there was a big red herring out there that people get Bell's palsy, which, half of their face can paralyze for some time and then gets better. But we've never heard about it. I mean, when it first came out, maybe like 3 or 4 people in Canada or someone, had that process, and that was the end of it. We haven't heard much more about this, and this is the beginning of this vaccine, and we just hear this, and there's going to be a very extreme low risk of having this issue. And as you know, they were mostly younger individuals rather than older, so we don't know the 100% mechanism of how this is happening. But I would say, weighing the risk and benefits, for example, you have hypertension, it's a silent killer. You don't really feel much.
Yeah.
Like you say, okay, if I have COVID, I may not die. Why should I take it? Same thing with hypertension. It's a silent killer. You don't know you have hypertension, but behind the scenes, it's basically damaging your end organs, your brain, your heart, your kidneys, and it may be too late once you find out and you want to get treated. Yes, we give medication to treat it, which will significantly reduce the process of heart attack and strokes. But yes, some medication has very slight side effects. So we weigh the risk and benefits. So as far as we get educated and we know it's overwhelmingly safe, then there should not be an issue for our patients to be worried. If I had the opportunity right now I would grab the first vaccine available to me so that, I would be safe and I would not cause more harm to myself, family, community, and so forth.
Thank you, doctor.
Well, thank you for the question. So we talk about sports, and I'm a consultant cardiologist, and I've probably evaluated over 150 athletes over the last year, maybe even more, patients that actually had COVID-19, these athletes. And I mentioned at least 10 days of rest, and at least they should get an EKG. There is a protocol to go through, but at my level, if you're a athlete, then whether you had symptoms or not symptoms, I would highly recommend at least an EKG, and based on symptoms, if they're still having chest pain, shoulders, and so forth, consider echocardiogram and then clearance. But right now, since we really don't understand this disease process, all these athletes, I do an EKG and echocardiogram, which looks at the muscle cells, and I pretty much clear them. So this is something to think about and to discuss that with your doctors if you are a serious athlete out there, and we want to keep everyone safe. Okay, so these are just brief slides, and then we can answer more questions.
There's several questions here we have, but we'll go through your slide. We'll go through your slide.
I'm done. This is actually the end of it. I can go off my slides right now and stop screen sharing, and then we can talk more.
Yeah, so there's several questions, doctor. So you already answered one with the J&J, and I'm glad you brought that up because, I took my J&J last Friday, and I know that there was many people here in San Joaquin County that took that. So I've been fine, just like any other effects that people have talked. I just like anything, I think, even if I take the flu shot, right, I for some reason I get tired that day, and that's all I had. So I'm glad you kind of really cleared that up for folks. The question is here: what happens if somebody doesn't get the second shot, either the Moderna or the Pfizer vaccine?
Right. Good. Another very good question. So 2 things. Number one, these are extremely effective vaccines. So you can think of it a 2-shot hypothesis. First one primes it, and second one really solidifies, cements it. So The first one, you will give a 70-80% protection from just one dose. The question we don't know is how long is it good for? Is it will it last 3, 4, 5, 6 months, 1 year? We don't know. So that's the part we are not sure of. So if you get a single shot, and we later found out it doesn't have to be exactly 3 weeks, it doesn't have to be exactly 4 weeks. It can be even 2 weeks off, and you still 2, 3 weeks even off that for the second dose, and you still get the benefit. So I would recommend, for any reason, if you had a lot of side effects or a lot of issues, and you may have some really bad allergic reaction, then you may want to not take the second one. But overwhelmingly, in my practice, close to 1,000 people have been vaccinated. We had almost no problems at all, absolutely nothing. And I highly recommend for people to do get their second dose, so that right now we're trying to find out. We know, because as you know, 3 or 4 months prior to January, for when we were able to get vaccinated, they went through study and research. So there are individuals out there that have been vaccinated 3, 4 months before anybody else through research, and they're 3, 4 months ahead of us, and they do titer checks, and they know that even up to 6, 7 months, because that's how far, how long we've had it on board, that it's quite safe, and they're significant. The titer, they're absolutely great, and they're protecting themselves. So we think Pfizer thinks that in a year we may have to have another booster shot. We'll see, based on the variants and so forth. But hopefully that answers your question.
Good. Thank you, doctor. There's another question here. Do you know of any underlying heart conditions people may have that put them in high risk of serious complications from the coronavirus?
Sure. So, as we mentioned before, people that are obese, have high blood pressure, have diabetes, in general, have higher chronic inflammatory markers within their body. Their immune system is not solid, and they are more prone, based on research, especially when we first encountered this first few months of last year, that significant number of patients end up hospitalized or dying had hypertension. So it goes back to what we mentioned earlier. The best intervention is prevention. If you're high risk for developing hypertension because your parents had hypertension, and I've seen more and more right now in my practice, young individuals in their teens coming with hypertension. And you know why? Because of obesity. Bad diet and obesity. Obesity would accelerate this hypertension, and they would have it at a much younger age, which we haven't seen that. Normally, it's a disease of 50s and 60-year-olds, not teenagers. So that's another big issue we have to deal with, is obesity.
Absolutely. Here's another question. We're seeing more and more studies come out involving how lack of sleep can negatively impact your health. Are there any heart complications that come out from lack of sleep?
Yes, actually, there was I think something that came out yesterday or the day before about lack of sleep, and people in their 50s, if they sleep less than 6 hours a day, then in their 70s they're going to have higher chance of Alzheimer's. So there has been many articles out even for lack of sleep and enhancing or increasing chances of coronary disease, diabetes, hypertension in the past few years. So the sweet spot is 6 hours. You have to get at least 6 hours of sleep. But the best would be at least 7 or 8 hours for everyone. If you sleep less than 6 hours, there's 20% more chance of heart attacks. What happens when you sleep, the body needs to rejuvenate, basically.
Yeah.
The cells have to regenerate. There's balancing of the hormones while we're asleep. The blood pressure and heart rate slows down, and during our deep sleep, good REM sleep. Not only that you have to get 6 hours, but you have to get good 6 hours. Some people wake up every hour and they have to go to the restroom because of prostate issues or God knows what else, or they have insomnia. So those are all also included within the 6 hours. You have to have good 6 hours of sleep. So if you don't get that, then you're chronically you will have elevated heart rate and elevated blood pressure, which can put strain on the heart. And that strain can lead to hypertension, diabetes, heart attacks. It can even lead to formation of fat buildup within your arteries that can eventually lead to heart attack and stroke. So yes, on top of diet and exercise, based on your question, we should add good sleep at nights.
See, there's two questions here. What sign should we be aware of in other people who may experience heart issues, and what are the best steps to take care of someone experiencing a heart issue?
Okay. So heart issue by itself, it's multifactorial. So we have heart failure, we have heart attacks, we have valve disease, we have people with arrhythmias. So it's a broad question that you ask. But in general, the one that can immediately have highest mortality is basically chest pains. And that's why we are so worried about chest pains. Mm-hmm. I'll give you a definition of classical chest pain. A classical chest pain comes on when you're exerting yourself, you get pressure, nausea, sweating, and this pressure, not pain necessarily. A lot of people think it's pain. But they say it's not pain, it's tightness. I feel like someone's grabbing my chest. Or sometimes they say, elephant sitting on my chest. And it may radiate to your jaw or your left shoulder. And that's because of the way the nerves are made around the heart and the brain gets confused. But it's actually coming from the heart when it's not getting enough oxygen because of blockages. So this is a typical symptom of worrisome chest pain that you need to, and if it's persistent, it's lasting more than 10 minutes, you just call 911. If it's a few minutes and goes away, then you should seek physicians or cardiologists help as soon as possible to figure out if you have an unstable plaque that needs to be taken care of. So that's basically chest pain. Having said that, a lot of older people, especially women, do not have classical symptoms. Sometimes they can have diffuse sweating. All of a sudden, they get anxious and they have diffuse sweating, cold sweats, shortness of breath, or back pains rather than chest pain, which could suggest that they have heart disease. So how do I get a lot of these calls. I can't just tell everyone go to ER. So we kind of try to figure that out. So we look at the risk factors. Are they young or old? If they're 30 years old, probably not the heart. If they're 50 years old and older and they have diabetes and they have hypertension and they smoke and they have family history, then yes, this is very worrisome. If anyone in that category have chest pain and the more they have is like playing Russian roulette, the more bullets you have in there, the more chance that you're going to die from the heart attack. So you want to reduce these. Some of these risk factors are modifiable, we can do something about, and some are not modifiable. You're stuck with a family history, you can't do anything about it. But you can do things that you can do to prevent that. So that basically as far as chest pain. Palpitations, it's a warning sign which can lead to atrial fibrillation, which is a worrisome arrhythmia that is very common now, especially more older, but now we're seeing it more in younger people. Risk factors are hypertension, aging, people that drink a lot of alcohol, people who do drugs, So the problem with atrial fibrillation is it can make you very short of breath, tired, fatigued, but even more worrisome, you can develop blood clots that can cause stroke. So I cannot give you a whole lecture on cardiology, but I think just knowing this, or if you pass out suddenly, that's a big sign that you gotta have immediate evaluation by
Yeah.
emergency room.
You mentioned a little bit cardiac issues. Are they hereditary?
So yes, there are some cardiac issues that's hereditary. The most important one being is having heart attacks, and that's why when people come to our practice, we do advanced lipid panel. Most people just do a basic lipid testing, cholesterol,
Mhm.
LDL, HDL, triglyceride, and go by that and say, why did this patient die suddenly because his cholesterol was perfect? Well, how did he die, for example? Of course, there's other risk factors, and the next is we look at this other component called LP little a, which is hereditary,
Mhm.
and most people don't look for that. And you can have a decent normal LDL, which is a bad cholesterol, but the LP little a could be so high, and that's usually genetic. So family history basically is defined as if you had a father or mother or brother or sister that had a heart attack who was male under age of 55 or female under age of 65, then that's considered a family history. That means you or had a heart attack or bypass or a stent or any of that. That means you have premature predisposition of developing blockages. So we individualize each patient. If I see, for example, you're in your 40s, you're male, you don't have a lot of risk factors, you're doing a little exercise, your cholesterol is borderline high, I'm kind of worried that you may or may not have some disease because you have family history. There are some early processes that we can do. For example, simple calcium score. Have you heard of calcium score?
No.
Okay, so basically, you go under this CAT scan machine for like 5 minutes. That's it, and you get out. No, nothing injected, nothing. So calcium, it correlates with blockages. So as you develop low fat buildup within your artery with inflammation process, it becomes calcified, and when it's calcified, you can actually see it under CAT scan, and it correlates with level of blockages. And there's a number that you get. If it's over, for example, 100, you should probably take aspirin once a day because you have significant, possibility of having heart disease. So bottom line is, so that take home message for people, if it's zero, if your calcium score is zero, then your chance of having a heart attack for the next 4 years is almost zero. So that means you have not developed even early signs of blockages. So that means you're probably doing the right diet, exercising, your family history is not affecting you. And then we can discuss how aggressive we need to do to treat your high, if you have borderline blood pressure or cholesterol and so forth. So yes, indeed, family history, especially in blockages, does exist with the heart. And then there are other congenital type of problems like valve issues that is not hereditary. It's more that when you were born, there was an error in process of generating, for example, the aortic valve. Usually it has 3 leaflets. We call it bicuspid. They end up coming with only 2. There's like, it's usually congenital. It's not necessarily hereditary. If it is, it's very mild or minor. And those are things that doesn't really affect patients until they're in their 50s or 60s or 70s. And most people, by chance, we find out that they have this process. But not to give you a long lecture, that's basically, yes, there are some process that is hereditary.
Good. Thank you, doctor. 2 last questions here. What are the possible long-term effects of a heart attack or other cardiac episodes?
So most people, like you mentioned earlier, when they have heart attack and we put a stent and now they have an open artery, they think they're totally cured and you can go back to your regular lifestyle. That's not true. It all depends how much of a damage did the heart sustain. If the damage was minimal, then with proper medication, they should be able to live life as normal as possible. If they went to visit a physician late, or they had a heart attack and they went to the hospital late, and there was more damage to the heart muscle, so the heart muscle is weakened, then um, then yes, they'll end up with congestive heart failure. We call them cardiac crippled because they can barely walk 10 yards and then short of breath. They need a lot of medication to keep their to make them feel better, and the mortality is much higher. They possibly may not make even next few years in life. So now with proper medication for heart failure and devices, people are living longer, even if they've sustained significant heart attack and heart damage. We can possibly treat them quite well and let them live longer. But yes, they'll end up having chronic issues with this forever. So indefinitely, they should be on aspirin, for example. And
Yeah. And the last question I have for you: are heart disease chronic, or can they be cured over time?
very good question. So there are different disease processes within the heart. Arrhythmias, for example, in young individual, someone in their 20s or 30s, they may have some issues within the heart. Is like a building; it has doors, walls, electricity, plumbing, right? So the electrical freeways may have an issue that they were born with, and instead of following the right path through the freeway, there's a shortage. There's an electrical shortage, for example, and they start having really, really, really rapid heartbeat, and they can feel short of breath, tired, and also suddenly even pass out. It's called SVT. Um, those are curable. Those, if it's diagnosed right, and we send them to the electrical doctors of the heart, it's called EP, they can go and localize that area and burn that extra pathway, and then all the electrical pathway impulses will go through the right freeway, and you will end up not having this arrhythmias, and you're pretty much very close to be cured. Atrial fibrillation, um, I won't necessarily say you're 100% cured, but very close to it. If diagnosed early, treatment doesn't help you, and you're the right age and right patient, and you can also have this ablation where they can go in and burn the area that's causing these irregular heartbeats, where it follows the right track, and you will have less possibility of having this arrhythmia. As far as blockages, it goes back to what we mentioned earlier. It's just putting a bandage over the wound. It doesn't really cure you because it's a systemic process. If you have an artery, for example, that's blocked in this area that is really tight, but you can see it in the other areas very mild. It's all over the arteries, not just one area. That's the area that became very tight. So it's a systemic process. And there are tests such as we call CRP, which looks at inflammatory process because of these fat buildup within the arteries, that helps us put this everything into perspective. So overall, there are some disease processes within the heart that's almost 100% curable. Most are not. They're a chronic condition, but very well manageable, that you can go back to your normal life, diet, exercise, do even half marathons, and live a good life. But it's a two-way street. You have to do your part and also listen to your physician and get educated, like what you are doing for the community right now, and we are doing here for the community. Education is everything.
Yeah. Yeah. No, I mean, I appreciate that, Doctor. Would any final message that you would like to leave us with?
Final message is that your brain, your heart, your body is a very precious part of your life. Take care of it so that you can have a healthy life, not only when you're young, but when you're in middle age, and when you're even through your elderly life. So diet, exercise, and we'll add, based on your question, good sleep will help you live a healthy, long life. And you have a healthy, long life, you will have a better family life and better community overall. And a better community will be uh, prosperous for everyone, where we can all live together, helping each other out, like what we are trying to do right now.
Well, with that, I want to thank you, Dr. Mashadi, for joining us today. This was extremely informative and helpful for raising awareness and education for all of us. You know, that we need to make sure that we're monitoring and maintaining our heart healthy. For me, in our district, you know, I see it. You know, it's right in front of us. You know, everywhere you go, there's fast food. But I also see a lot of folks that are really trying to maintain, you know, run, exercise. I mean, even at the Capitol, I hear folks that, you know, they're challenging themselves. You know, even us as legislators, we challenge ourselves to join marathons. But I think that this was very informative because it's important for all of us. It's important for my district. It's important for us to keep, you know, getting this information, because it's so easy for us to just be distracted and start getting back to normal eating, normal, you know, that shouldn't be the normal, right? I mean, we should just, and I hate using the word diet. I think it should just be part of our normal life, that we eat healthy. And but again, thank you, everyone. Thank you for tuning in, and we'll continue having more messaging on our website. Again, everyone, this is Assemblymember Carlos Villapudua. I had Dr. Mashadi here, so thank you, Doctor, for all the information you provided to us today.